Hello everyone, welcome to Africa Independent Television. This is Talking Health with Dr. Laz. Talking Health with Dr. Laz is a new program on television and it seeks to fill the information gap as it regards our healthcare system. Covid-19 has come up with a lot of challenges affecting our healthcare sector, and it's important that media houses and media practitioners take actions to find solutions and also find answers to many questions that citizens are asking. My name is Dr. Laz Eze. Welcome. Many of you may have seen me several times on Africa Independent Television, AIT, talking about health programs or health issues in this country. Some may know me more as a health advocate. Yes, I am. I'm a medical doctor. I'm a health policy and management professional, and I've been doing a lot within the healthcare system. But one of the challenges we find out is that lack of information is making a lot of persons take certain decisions that have a lot of implication on their lives. And I'm really very excited that Africa Independent Television has come up with this idea, and we are going to use this program to meet many of the health information needs and at the same time answer so many questions and fill many gaps as it has to do with health information. Talking Health with Dr. Laz is going to be bringing professionals from different aspects of the healthcare sector. We'll be talking to patients who are the most important persons, who are the ones all of us are working for. We are going to be talking to healthcare providers. We are going to be talking to policymakers. We are going to be talking to civil society organizations. We are going to be talking to a variety of persons who will bring opinions. And keep watching this program because you'll find many answers to many questions that have been boggling your mind as it has to do with health. Today on the program, we'll be starting with understanding our healthcare system. When we talk about our healthcare system, not many persons have the full knowledge of what it's all about. Of course, it's like a building. Imagine you have a building, and that building has 6 pillars. The World Health Organization have described the 6 pillars as 6 building blocks of our healthcare system. I'll quickly run through them before I introduce my guest and we get into the conversation because there's so much to talk about and there's so much you stand to learn in this program. Number 1 is human resource for health. Human resource for health is the building block that speaks to all cadres of healthcare workers who work in the hospital or who work in any other health facility. So it speaks to doctors, nurses, physiotherapists, radiologists, midwives, dentists, a whole lot of them. And it also speaks to support staff, including the accountants, the cleaners, the security, those who man the generator house, and even the sweepers and messengers in the hospital or in any health facility. Number 2 is health management information system. When you go to any hospital, the first thing you collect is a card. That card gives you an identity, and they open a folder for you. They keep records. Those records are things that you use to make health decisions. We use data to make health decisions, and it's really very important. So it's the number 2 pillar. 3 is medical products, vaccines, and technologies. It speaks to our drugs, reagents, equipment, vaccines used for immunizations, the various technologies that are used in medical practice. Number 4 is healthcare financing. Healthcare financing speaks to who funds the healthcare system, who funds the treatment you receive. So it begins from the budget of the government or even from the medium-term expenditure framework to the annual budgets of the federal government, state governments, or local governments. It also speaks to the funding for healthcare services when you receive healthcare, whether you are paying out of pocket or whether a health insurance is the one paying for you. Whichever way, how we finance our health sector is very important. Number 5 is leadership and governance. Leadership and governance begins from the village level up till the national government. So the leadership begins from even the health facility where you have a leadership, to the village development committees, to the ward, local government, state, and national. We are going to be hearing more about it from the expert who is our guest today. And the last but not the least is service delivery. Service delivery speaks to the quality of healthcare service you receive when you go to a healthcare facility, be it a primary health center, a general hospital, specialist hospital, or a teaching hospital. So all the other building blocks working together will determine the quality of healthcare that you are going to receive. So 6 building blocks, and all of them must be strong for our healthcare system to function strongly. So let me introduce my guest. My guest is a health policy and systems expert. He's a medical doctor, a health economist, and the founding partner of Health Systems Consult Limited, HSCL. My guest is Dr. Nkata Chuku. So before we bring him on, because this show we are going to, imagine that you are in a classroom, so we are going to project a lot of information on the board and we speak to it. But we are going to be doing that right after the break. But before that break, please follow us on our social media handles that are projected on your screen at Talk Health Niger on Twitter, Facebook, or Instagram, or Talk Health Niger TV on YouTube. Feel free to share your opinions, make comments, ask questions. During and after the program, we'll surely provide feedback. Let's take a break. We'll be right back. Welcome back to Talking Health with Dr. Laz. Potentially going to become your favorite health program on television. I'll be introducing my guest further, Dr. Nkata Chuku. Welcome to the show.
Thank you very much, Dr.
Dr. Nkata Chuku, like I mentioned before the break, is a health systems expert, a medical doctor, and the founding partner of Health Systems Consult Limited, HSCL. Dr. Nkata Chuku, COVID has done a lot to our health system, a lot of damage. And since it started, there's been a lot of conversation around health systems, weak health system, and some people will be wondering, what is this health system about? How does it solve the problem in their primary healthcare facilities? And what does it mean that COVID has made it weaker? You know, a lot of reports around rejection of patients, around people told no bed spaces. Some of these things are not new anyway, but it appears to have gotten worse. So our viewers would like to know what is a health system, starting from the ward level, and how can we make it stronger, leveraging on the increased, perhaps, health expenditure that may have been occasioned by the COVID-19 pandemic. And of course, we are going to be talking to the screen, on some of the slides that is going to be projected.
Thank you very much, Dr. Laz. My pleasure to be here. So thanks for inviting me to this maiden edition of Talking Health with Dr. Laz. And I must say congratulations to you.
Thank you.
To African Independent Television, because this is really, really needed, particularly right now, that we need platforms that provide the right information and bridge the information gap. So our health system, why we say our health system was already not doing well before COVID is, you'll recall we were ranked 187th out of about 195 countries.
That was 20 years ago.
Yeah, in health systems ranking. A lot has happened. We can say, oh, we're better than we were back then, right? Mm-hmm. But if you look at the other matrices or the other indicators that show that there's been an improvement in the system, we've not done well. So it's difficult to say, oh, that was 20 years ago, so maybe right now we're within the top 20, we're within the top 50. Because
so what are some of those metrics?
So if you look at the fact that we still contribute to the second highest number of under 5 and maternal deaths globally, just second to India.
So in terms of women dying from pregnancy-related issues, we are number 2 in the world.
Yes, we're number 2 in the world, total number of women. The same with number of children under 5 dying from mostly, communicable diseases that are easily managed, some vaccine preventable and some others that are relatively easy to manage. So our health system, we can't really say we've improved from the 187th, because when the system improves, the outputs and the outcome, which reflects in the mortality,
in other words, the results are going to show that there's been
there's been an improvement. But we don't have results that give us any confidence that we've left that 187th.
I kind of agree with you, because the last 3 surveys that were done, the National Demographic and Health Survey, the maternal deaths, that's women dying from pregnancy-related issues, had not essentially improved.
Yes.
In fact, from 2008, it became worse in 2013, and 2018 became a little lower than that of 2013. But it's more than 500 women dying out of 100,000 live births. Yeah.
And over 100 children dying, out of 1,000. So, so we're still not, it's very clear that there's still a lot to be done. And the reality is, it's good you've run through the building blocks. We have roughly 4 doctors to 10,000 Nigerians, and even fewer nurses. So we have lower beds per 1,000 or 10,000 population than the sub-Saharan African average, and than even our neighbors like Ghana and some other countries who, GDP-wise, were a lot better than that. You would expect we should be doing better than.
But it says that in terms of human resources, it appears we are doing better than a lot of sub-Saharan African countries.
So when it comes to human resources, before we go to human resources, when it comes to total health expenditure, we're not doing badly if you look at the WHO benchmark. But that's when you look at total health expenditure, total. Now, over 65% of that total health expenditure comes from household and individual out-of-pocket expenses.
So that's the money we use to buy from the chemists, the money we pay when we go to hospitals.
Yes, so the money we spend at the patent medicine vendors, the pharmacy, the money we pay when we go to see the community midwife in the village or the hospital
that the pregnant women collect
has to provide the JIC, all those other things you have to buy, even in public hospitals where it's supposed to be free, and then you still get a list to bring some commodities. So all that money put together, we are actually funding roughly 70% of our total health expenditure. Now, our public health expenditure as a percentage of the total, we're one of the lowest in Africa. So when you look at the total, that seems to look good, but because you're funding it from the wrong source, a source that actually ends up impoverishing Nigerians. And
so what that means is, yes, we are spending so much, but let's assume that Nigeria has spent 100 naira on health. 70 out of that 100 naira is from the pocket of the citizens.
Yes.
So the other 30 naira is, you combine the budget, you combine the one from donor partners, or the private sector players who are,
Yes, like employers who are, paying on behalf of their employees and all that put together makes up 30%.
This looks like a good time to look at the screen and try to explain this with some diagrams. Yes, introduction to the World Health Systems. There's a lot of information here. And
so I think, well, the good thing with us in Nigeria is when it comes to policies and strategies, we're not lacking. We have some of the best policies and strategies in the world for all sectors, particularly the health sector, where, at least we're privy to a lot of what is out there. Now, the health system is structured across 3 levels: the primary care level, the secondary care level, and the tertiary care level. At least in Nigeria, we've not gone into the quaternary care level.
So which ones are the primary?
So the primary care level is where you get your basic your basic services that are mostly outpatient, where you're not on admissions with complications and all that. And those are provided within the communities and within the primary healthcare facilities that are made up of health clinics, outposts, and primary healthcare centers. Yes, so the dispensaries and all that. So from the community up to that level. Once you move from that level to your general hospitals, or the equivalent of general hospitals in the private sector.
District hospitals or cottage hospitals.
And even private facilities where they now offer inpatient services and some certain specialties and all that. You are at the secondary care level. When you now get to the level like the tertiary hospitals, whether public or private, where you now have specialists, you know.
Like the teaching hospitals.
Like the teaching hospitals, the federal medical centers, and some of our private hospitals, where services are now segmented by specialties. You are now at the tertiary care level. Now, the primary care level is really the bedrock.
Yes, and that's what this system talks about.
Yes. So the World Health System is Nigeria's system for delivering its primary care services, right? And why World Health System? This was adopted in 2001 by the National Primary Healthcare Development Agency as the country's strategy for delivering primary health care, right?
Yes.
The reason why we use the word World Health System, in some places they use other, in some countries they use other names, is because Nigeria, the word is the lowest recognized governance structure, you know. So the ward should be responsible for organizing those primary care services. Okay. So within each ward, ideally, you should have one fully functional primary health care center.
Yes.
And then a couple of dispensaries and all that.
To promote full and active participation of ownership. There's a place they put about that
the functionality, yeah, that's under expected a functional PHC in each ward. So each ward should have a minimum one functional. It shouldn't have only one functional, but at a minimum, worst case scenario, one functional. With a collection of other PHCs, primary healthcare centers and dispensaries and all that, right? Now, what we've also improved on is this functionality has now been expanded to not just be one public functional primary healthcare center, but one functional primary healthcare center, be it public or private. As long as there is that.
So irrespective of who is providing it.
Yes, irrespective of who owns it.
Everyone should have one full functional. There was a study, I think 2017, by the Save 1 Million Lives program that looks at functionality of they call it health facility assessment.
Yes.
You know, and it said we have over 30,000 primary healthcare centers. Yes. And less than 10,000, about 6,000 or thereabout, that are the ones that could be said to be functional. Yeah. And that may have informed when federal government announced the plan to strengthen 10,000 PHCs across the country. But let's move to the next slide because our time is going very fast. I will speak to this in a minute, then we take a break, then we'll come back and continue the conversation.
Sure. So in terms of how this World Health System is structured, right?
Yes.
You have the facility. So actually you have the community, and within a community, you have the facilities, right?
Yes.
And then the health authorities and the community leadership co-manage those facilities as joint assets that belongs to the community and the ward, and hence the World Health System. So what you see
that
here
means is the health centers belongs to the community or the village where it's located, and they are supposed to be a part of management of that health center.
They're supposed to be a part of the resourcing, the management, and the monitoring and evaluation of those health centers. So that's what this basically says. So where you have a facility management committee, it has community members. But then at the community level, you also have the Village Development Committee, and then to the Ward Development Committee and the LG Health Authority. So even with the Facility Management Committee, you have the representatives of the village and the ward in those. So now that we're moving and advocating for DFF, direct facility financing, where facilities open accounts and their monies, their interest is sent directly to them. The chair of the Village Development Committee or the Ward Development Committee is a co-signatory along with the in charge of the facility.
Wow. You know, it will be interesting. We are going to put this slide out on our social media platforms, and I'm sure you're going to learn a lot from it. So the Facility Management Committee doesn't appear to exist in many of the places. And if you don't take out anything here in this program today, note that every primary healthcare center that is in your community or village is supposed to have a facility management committee that is supposed to promote improvement and ensuring that patients have satisfaction, ensuring that pregnant women are addressed with respect when they go for immunization for their children or even for antenatal care. So we are going to take a short break, and when we come back, we'll continue this conversation in learning more about the structure of our healthcare system. And Dr. Chuku is also going to be sharing some thoughts on the results we've had in recent past, as well as some recommendations that we think that governments at all levels should take to make our healthcare system stronger. We'll be right back. Please stay with us. Welcome back to Talking Health with Dr. Laz. I've been speaking with Dr. Nkata Chuku, founding partner of Health Systems Consult Limited, and we've been discussing about the healthcare system, the healthcare structure in Nigeria, and for us to know more about how to make it work. Dr. Nkata Chuku, good to be back, and we have to move to the next slide because there's a whole lot of information in all of these slides. You know, we try to summarize them as much as possible. And of course, our viewers are going to check out on our social media platforms and ask more questions. I definitely expect that there will be a lot of questions around this. Health infrastructure is perhaps appears to be where politicians or policymakers tend to do more in terms of building, painting, and roofing and all that. But could you speak briefly to that and, of course, the other blocks?
Okay. So basically, yeah, like you said, these are three, even though a lot has been bundled into them. But you need to have these three available to be able to deliver any kind of primary healthcare service or any level of care in the first place. Okay. So health infrastructure is basically making sure that there is a building with the roof, a space that is not leaking, a space that respects the privacy of patients and the confidentiality needs between them and their care providers. And health infrastructure also should go beyond the building to the basic diagnostic equipment. Yeah. You know, be it at the primary care level where you have lower technology point of care diagnostic equipment and all that, as well as the when you now loop in the other bits, which is the commodities bit, the commodities, the medicaments and all that. Now you need the human beings to be able to deliver service. In fact, the most important, in my opinion, is usually the human being and the money you need to have the human beings. Because a lot of services you can deliver at home. The preventive, promotive, and a lot of the primary care services, you can deliver even outside the facility setting once you have the right human being and the logistics and the commodities for them to deliver services. So the human resource for health, and this is one place where we really, really do not do well. You know, we spend a lot, there is a lot of emphasis on contracts, projects, and commissioning. So even when you say, oh, there's something wrong with the health system, people go renovate, build new ones, take pictures, paint it, and do all sorts of things, right? But it's still not able to deliver service. It might as well be a hotel or a residential building. If you do not have the people with the capacity and rightly motivated by they get paid, you know, they get all the allowances and all that, and the environment is conducive for them, then it's really not a facility. So, and the service provision, the service, what we have here is a list of service expectations at the primary care level. So once you have the infrastructure and the human resource, and you have the funding for the logistics and all the other things to be there, you have a bouquet or a package of services that you expect to be delivered at the primary care level.
Yes, Dr. Chuku, sorry for taking you back on the human resources. Quickly, not many health facilities have a good number of human health workers. So if you have to recommend like 5 out of these 35 that is listed, what would be the composition you want to recommend?
I think at the primary care level, we need to be realistic, and we also need to look at evidence, right? With the services that should be delivered at that level, the most important people are the midwives to deal with the issues of maternal health and even child health, the midwife and the nurse, the community health extension workers. Yeah, the CHOOS and the JCHOOS. And of course, we need the people who can run a mix of the data, the logistics, and all that.
That would be great. Let's move to the next slide quickly. And we're going to just make recommendations on what we need to do. There's a whole lot of information there. Yes, World Minimum Package. We'll show it on social media handles. Yes. So progress so far in implementation and your recommendations. Yeah.
So, well, there's no need running through this, but you can see that we're not where we should be per 1,000 beds. You know, so the numbers don't look good. Now, in terms of where we should be heading to, you know, we know the problems and we've rehashed over and over again. First is we have a task shifting policy. We really need to implement the basic minimum of making sure nurse midwife and the CHUs are in place and properly trained and supported. If we need to have hubs, we can have hubs where the doctor is somewhere and we linked up, because we need to be realistic. Now, this direct facility financing needs to happen like day before yesterday across all facilities. Once money starts going down from several different levels before it gets to the facility, most of these facilities never get impressed, so people are demotivated. Healthcare workers' salaries must be paid. You can't expect people to save lives when they're not even able to take care of themselves and save.
Thank you very much, our viewers. We wish to continue this conversation, but we have to obey the time, and we're going to continue the conversation on our social media handles. Please follow us and ask questions, make your contributions, put up your opinions on all our handles displayed on your screen. That's the much we can take today on Talking Health with Dr. Laz. And thank you, Dr. Chuku, once again for being with us today. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.